Welcome everyone. I am Dr. Swati Mehta. Our today's topic is dysmenorrhea, one of the most common gynecological complaints encountered in clinical practice. Dysmenorrhea refers to painful menstruation and significantly affects the quality of life of many women. On this presentation, we will study its definition, classification, causes, clinical features, diagnosis, treatment, and important homeopathic therapeutics. Dysmenorrhea is defined as painful menstruation characterized by cramping pain in the lower abdomen that may radiate to the back and thighs. It is frequently accompanied by nausea, vomiting, diarrhea, headache, dizziness, and fatigue with general weakness. Nearly half of menstruating women experience some degree of menstrual pain. However, about 5 to 10% of women, the pain is severe enough to interfere with the school, work, and daily activities. Understanding the underlying cause is essential for proper management. Dysmenorrhea is classified into two major types. Primary dysmenorrhea occurs without any detectable pelvic pathology. The pain is functional and usually related to hormonal changes and excessive uterine contractions. Secondary dysmenorrhea occurs due to identifiable pelvic pathology such as endometriosis, fibroid, adenomyosis, pelvic inflammatory disease, or uterine anomalies. Differentiating between primary and secondary dysmenorrhea is important because treatment depends on the underlying cause. Primary dysmenorrhea generally begins within 1 to 2 years after menarche, when ovulation cycles becomes established. It may be classified into spasmodic and membranous forms. Spasmodic dysmenorrhea is characterized by severe cramping uterine pain. Membranous dysmenorrhea represents an extreme form where pieces of endometrial tissue may be expelled as cast, causing intense pain. The condition is more common in young unmarried women and often improves after the childbirth. The causes of primary dysmenorrhea are multifactorial. Psychological factors such as anxiety, stress, emotional tension, and fear can contribute significantly. Anatomical anomalies includes cervical stenosis, bicornuate uterus, uterine hypoplasia, and defective uterine polarity. Autonomic imbalance may lead to excessive sympathetic stimulations, causing increased uterine muscle contractions. Vasopressin levels may also increase during menstruation, stimulating prostaglandin production and enhancing uterine contractions, leading to pain. Prostaglandins play a central role in pathogenesis of primary dysmenorrhea. During the late luteal phase, progesterone levels decline, resulting in increased production of prostaglandins, especially PGF2 alpha and PGE2. These substances cause powerful uterine contractions, increase uterine tones, reduce blood supply, and ischemia of the uterine muscle. The resulting ischemia is responsible for the characteristic cramping pain experienced during menstruation. In some women, deficiency of enzymes that prevent clot formation leading to coagulation and shredding of endometrial cast further aggravating the pain. Pain typically begins a few hours before menstruation or shortly after bleeding starts and may continue for 48 to 72 hours. The pain is spasmodic, labor-like, and located in the lower abdomen. It often radiates to the lower back and inner thighs. Associated symptoms include nausea, vomiting, diarrhea, headache, fatigue, dizziness, and occasional fainting. Many patients obtain relief from movement, massage, heat application, or pressure. Physical examination is usually normal except for mild lower abdominal tenderness. When evaluating dysmenorrhea, it is essential to rule out secondary cause. The cyclic nature of pain should be confirmed. Differential diagnosis includes uterine fibroids, endometriosis, ectopic pregnancy, threatened abortion, pelvic inflammatory disease, urinary tract infections, and other causes of acute abdominal pain. A detailed menstrual history and clinical examinations are crucial. Management includes reassurance, counseling, exercise, and lifestyle modification. Oral contraceptive pills suppress ovulation and reduce prostaglandin production. NSAIDs such as mefenamic acid, ibuprofen, and diclofenac are highly effective because they inhibit prostaglandin synthesis. So these are the allopathic medicines which are used by allopaths to relieve pain in dysmenorrhea. We are having lots of other medicines and we will discuss afterwards. These medications should ideally be started before or at the onset of pain and continued regularly during menstruation. Many women experience spontaneous improvement after the childbirth. Secondary dysmenorrhea usually develops years after menarche. Unlike primary dysmenorrhea, the pain often begins several days before menstruation and may continue throughout the menstrual period or even after bleeding stops. The pain is commonly dull, aching, and located in the pelvis or lower back. The pattern should always raise suspicion of underlying pelvic pathology. Common causes includes endometriosis, adenomyosis, fibroids, congenital uterine anomalies, cervical stenosis, endometrial polyps, pelvic inflammatory disease, and intrauterine contraceptive device. Treating the underlying pathology is essential for successful management of secondary amenorrhea. Clinical examination may reveal pelvic abnormalities. Investigations such as ultrasonography, hysteroscopy, laparoscopy, and hysterosalpingography helps to identify the underlying causes. These investigations are particularly important when symptoms are severe or progressive. Let us now understand the important differences between spasmodic dysmenorrhea and congestive dysmenorrhea. Spasmodic dysmenorrhea is the most common type seen in adolescents and young women. It occurs due to excessive uterine contractions, usually mediated by prostaglandins. The pain is colicky, cramping, and labor-like in nature. It generally starts just before or with the onset of menstruation and lasts for 1 to 3 days. The pain is mainly felt in the lower abdomen and many radiates to the back and thighs. Associated symptoms such as nausea, vomiting, diarrhea, sweating, and faintness are common. Pelvic examination is usually normal and the pain is often relieved by heat, pressure, and movement. On the other hand, congestive dysmenorrhea is more commonly seen in older women and is associated with pelvic congestion or underlying pelvic pathology. The pain begins several days before menstruation and is typically dull, heavy, aching, or throbbing in character. It is felt in pelvic, lower abdomen, and lower back. Unlike spasmodic dysmenorrhea, the pain often improves once the menstrual flow becomes fully established. Patient may also complain of pelvic heaviness, breast tenderness, headache, and irritability. Pelvic examination may reveal the congestion or other abnormalities. From homeopathic perspective, remedies such as magnesium phos, gelsemium, colophyllum, viburnum opulus, and chamomilla are commonly indicated in spasmodic dysmenorrhea, whereas belladonna, cactus G, and simicifuga are frequently prescribed in congestive dysmenorrhea. A simple way to remember this difference is spasmodic dysmenorrhea is characterized by uterine spasms and cramping pain that starts with the menstruation, while congestive dysmenorrhea is characterized by pelvic congestion and heavy aching pain that begins before menstruation and improves once the flow is established. Therefore, the nature, timing, and cause of pain are the key factors that help us differentiate spasmodic dysmenorrhea from congestive dysmenorrhea and guide the selections of the most appropriate homeopathic remedy. These are the key points for students. Spasmodic dysmenorrhea means cramping plus colicky. Pain, uterine muscle spasm is the cause, most commonly in young girls, and pain starts with the menstruation. While in case of congestive dysmenorrhea, heavy plus throbbing plus aching pain, dull pain with pelvic congestion, commonly after the age of 25 and onwards. Pain starts before menstruation and it improves when the flow becomes established. So sudden painful cramps, adolescence, and starts with menses, that is the spasmodic, congested pelvic, heavy aching pain or dull pain, earlier onset before menses and subsides after free flow, that is the congestive dysmenorrhea. Homeopathy offers individualized treatment based on the patient's physical symptoms, mental characteristics, modalities, and associated complaints. Let us now study the important remedies used in dysmenorrhea and their indications. Many of these medicines used by me in my practice. So all are, you can say, well clinically proved medicines and you can use in your practice. Gelsemium is one of the leading remedies for spasmodic dysmenorrhea associated with emotional causes. The patient is timid, anxious, weak, and lack of confidence. Complaints often follow fear, anticipation, excitement, or bad news. The causative factor, if we consider, that is lack of muscular coordination, and that means the upper uterine segment and lower uterine segment, the rhythm is disturbed. So because of the contraction and relaxation of upper and lower uterine segment is a rhythm, and that causes pain. The menstrual flow is scanty and delayed. There is a sensation as if the uterus is tightly squeezed. So this is the common pain, you can say. In gelsemium, patient says that my uterus is squeezed. Pain extends to the back and hips and is associated with dullness, dizziness, and drowsiness. So dullness, dizziness, and drowsiness are the 3 Ds which are very important in gelsemium. There is muscular weakness too. The patient improves from motion, open air, bending forward, and urination. So better by urination is again a peculiar symptom of gelsemium. Magnesium phos is considered one of the best remedies for spasmodic and membranous dysmenorrhea. The pains are sudden, shooting, lightning-like, and comes in waves. The patient is extremely sensitive to cold and obtain remarkable relief from heat and firm pressure. So heat is important. Patient is better by heat. The causative factor we can consider here is the rigidity of os. And second is the discharge, which is menstrual discharge, must be non-coagulable, but here there is a stringy discharge, means there is a cast or strings or endometrial pieces are there. So that is one of the cause of spasmodic dysmenorrhea. Menses are often early, dark, and stringy. Whenever menstrual cramps are relieved by hot application, pressure, we have to think about magnesium phos. It is also used for ovarian neuralgia, and patient is having great dread of uncovering because patient is though chilly, patient does not want to uncover the body, and aggravated by cold bathing and cold washing, better by pressure and warmth. That is the peculiar of McFOS. McFOS we can use in homeopathic doses like McFOS 1 mg at the time of spasmodic dysmenorrhea, repeated every 10 to 15 minutes, or McFOS 6x as a biochemic, 4 to 6 tablets every half an hour to relieve the pain. Borax is useful in membranous dysmenorrhea with marked nervous sensibility. The patient is easily startled by noise and has great anxiety for downward motion. The menstrual flow is often early, profuse, and accompanied by severe griping pain, nausea, and backache. Menses is hot. Associated symptoms include aphthous, ulcers, valvular itching, and extreme nervousness. There is pruritus vulvae, means itching at the vulva is also one of the symptom of borax. And here also the discharge is non-coagulable, and that's why that is used for membranous dysmenorrhea. Nux vomica is indicated in irritable, ambitious, oversensitive, zealous woman who is highly civilized. The patient is easily angered, impatient, and intolerant of contradiction. Menstruation is often irregular, early, profuse, and accompanied by violent spasmodic pain. So dysmenorrhea, there is cramps spread over the whole body. The blood is dark or black with fainting spells. So patient may faint because of the severe pain. Pain in the sacrum and constant urging to stool. The patient is hypersensitive to noise, odors, light, and external impression. This remedy is especially valuable in sedentary women with mental overwork and stress. Anxiety with irritability is also one of the cause, and that leads to commit suicide. That is the inclination. But patient is afraid to die. So this is a contradictory symptom. Patient wants to do suicide but afraid to die. That is the peculiar of Nux vomica. Viburnum opulus is one of the most important remedies for spasmodic dysmenorrhea before the menstrual flow begins. The pain starts in the back and extends to the uterus and thighs. Severe cramping, nausea, faintness, and nervousness are the characteristic. The menstrual flow is scanty, delayed, and offensive. So very scanty menses remains only for hours. That is the peculiar symptoms of viburnum opulus. Patient is having colicky pain with constant nausea and vomiting. Dysmenorrhea with flatulence and loud eructations and nervousness. So gastric complaints is also present. The leukorrhea is excoriating. Patient is aggravated by lying on affected side and better by open air and resting. Pain in the back ends in a cramp in uterus or go down faces to the thighs, and cramps in calf before menses. So these are the symptoms we can consider in viburnum opulus. Patient is having very nervous and spasmodic effects. Patient can't keep herself still. The patient feels relief once menstruation becomes established. Xanthosylum is the only medicine for neuralgic dysmenorrhea. The pain is agonizing, grinding, and radiate to the thighs, legs, and even throughout the body. Patients are usually thin, weak, nervous, and suffer from headache and insomnia. The menstrual flow is dark and thick. Pain in back down to the thighs along with the genital nerves. That is also a peculiar symptom of xanthosylum. Menses almost black. That is also one of the peculiar symptom of xanthosylum. Neuralgic dysmenorrhea with neuralgic headache and pain in back and down to the thighs. Ovarian neuralgia is also present. Leukorrhea replaces menses. This is important. Patient feels that menses appear but only leukorrhea is present. So that is also xanthosylum. Patient is having dreams of flying and mentally depressed. So left-sided ovarian pain extending down to the thighs is a particularly important keynote for xanthosylum. Only one medicine for neuralgic dysmenorrhea. Belladonna is a leading remedy for congestive dysmenorrhea. The patient experiences sudden, intense throbbing pains with marked pelvic congestion. We all are knowing that belladonna is a good medicine, or you can say one of the best medicine for any type of congestion. So it is best for congestive dysmenorrhea. Menstrual flow is bright red, hot, profuse and early. The abdomen is extremely sensitive to touch and jarring. That means abdomen tender, distended and better by least jar, even of the bed. Patient is obliged to walk with great care for fear of the jar. So whenever patient is having slightest jar or noise, patient is aggravated. The pain. Pain in right ileocecal region, which is aggravated by slightest touch even of the bed cover. Breast feels heavy, hard and red. Patient craves lemonade. Patient feels sleepy but cannot sleep. And again one other cause, that is rigidity of os. So we can use this medicine for both spasmodic as well as congestive. But congestive is more indicated than the spasmodic. And this is a medicine for metritis. Again inflammation of the endometrium. Belladonna is the medicine to be think about. So belladonna should be considered when there is a redness, heat, throbbing and acute inflammatory symptoms. Colophyllum is especially useful for spasmodic dysmenorrhea associated with the rigidity of cervix. So rigidity of os is the cause of spasmodic dysmenorrhea. The pain are intermittent, cramp-like and fly from one part of the body to the other. Menstruation may be delayed with scanty flow. Women with a history of chorea, hysteria, epilepsy or nervous disorders often requires this remedy. Dysmenorrhea, where the pain flies to uterus from the uterus to the other parts of the body, and that is the peculiar symptoms of colophyllum. And extraordinary rigidity of the os is the indication of dysmenorrhea of colophyllum. Ignatia is indicated in highly emotional sensitive women. Dysmenorrhea follows grief, disappointment, emotional shock or suppressed emotions. So these are the causes of spasmodic dysmenorrhea. The patient desires solitude and tends to brood over the problems. Menses may be early, profuse, black or scanty. There is mood changes, sighing, emotional instability and fainting tendencies are common. So wherever we find out all these bad effects of anger, grief, disappointed love, desire for solitude, and with that patient is sexually frigidity developed, then ignatia is a medicine. And again all the causes are from the psychological background. Cocculus is suitable for exhausted nervous women whose complaints arise from loss of sleep, mental strain, grief, or caregiving duties. The patient feels extremely weak during menstruation. So painful pressing in the uterine region followed by hemorrhoids, that is also one of the cause of pain during menstruation. There is purulent gushing leukorrhea between the menses, very weakening the patient, and that can Patient is so weak, patient can scarcely able to speak. During the effort to menstruate, she is so weak that she is scarcely able to stand from the weakness of the lower limbs. Leukorrhea in place of menses. Again here this is also the another medicine where leukorrhea in place of menses, or between the periods like washing of meat or light serum. So you cannot differentiate this leukorrhea is this discharge is leukorrhea or it is a menstrual discharge. And that is the peculiarity of cocculus. It is adapted to the bookworm woman who is very sensitive romantic girls with irregular menstruation and the woman debilitated by sexual access. So both the way, both extremes of women, unmarried or married and childless women are the indication of cocculus. Weakness is so profound that standing becomes difficult. That is the peculiar symptom of cocculus. Semicifuga is indicated when dysmenorrhea is associated with ovarian neuralgia and marked nervous symptoms. Pain radiates across the pelvis and down to the thighs. Menses are dark, offensive, profuse, and irregular. The patient is depressed, fearful, talkative, and experiences a constant sense of impending doom. Patient is having great depression with dream of impending evil. So patient always feel that some evil is there and that causes this type of pain or this type of disease condition in her body. Pain immediately before menses. That means this medicine is for spasmodic dysmenorrhea. Menses profuse dark coagulated. So coagulation again is there. Then we can consider this is for congestive dysmenorrhea too. Offensive menses with backache, nervousness, and irregularity. Ovarian neuralgia is also we can find out in this, and patient is having pain from hip to hip. Patient is having fear to riding in a closed carriage or being obliged to jump out. So patient cannot be able to travel in a closed carriage. And menses following disappearance of neuralgia. So patient is having neuralgia which is disappear when menses appears. Cramps in the limbs and in the calves. Chamomilla is the remedy for unbearable pain and extreme irritability. The patient becomes angry, restless, and cannot tolerate the pain. Menstrual flow is dark, clotted, and associated with labor-like pain. So labor-like pain again indicated for spasmodic dysmenorrhea. Patient intolerance of pain. With that, patient is having inflamed nipple which is very tender to touch. Extremely sensitive to every pain and always complaining of the pain. Patient aversion to talk and answers. So this is also you can consider the mental or psychological conditions where patient is not able to talk to anybody. Aggravated by heat, aggravated by evening, and patient is aggravated by eructations even. The patient complains continuously and become highly sensitive to every sensation we can think about chamomilla. Cactus gratifolus is useful in congestive dysmenorrhea with intense pelvic congestion. The patient experiences a sensation as if the body or uterus is tightly constricted by an iron band. Menstrual flow is dark, black, and lumpy. So here we can differentiate the pain. Pain in gelsemium sensation as if uterus is squeezed. So that is spasmodic dysmenorrhea. And here there is a pain which is feel that is twisted with the iron bar. So that is the congestive dysmenorrhea. Menstrual flow ceases when lying down. Palpitation day and night, aggravated when walking and lying on left side. Dysmenorrhea with pulsating pain in uterus and ovaries. So palpitation often accompanied menstrual complaints, especially around the onset of menses. We can consider cactus G. Dysmenorrhea is a common condition that can significantly affect a woman's physical, emotional, and social well-being. Accurate diagnosis is essential to distinguish primary from secondary dysmenorrhea. Homeopathic prescribing is based on individualization, considering the patient's mental state, menstrual characteristics, modalities, and associated symptoms. Understanding the keynotes of remedies such as Gelsemium, Magnesia Phos, Belladonna, Colophyllum, Simicifuga, and others help in selecting the most appropriate medicine for each patient. These all medicines you can use in a frequency of the doses to prevent the pain. So we can use frequently means every 2 hours or 1 hour or half an hour according to the severity of the pain. And most commonly we are using these medicines in the higher potency or middle potency because it is a pain, so that is a psychological condition. Thank you for watching this video. If you found this lecture useful, please like, share and subscribe for more homeopathic gynecological lectures and clinical discussions. Thank you so much.